WHIS is a platform. We're all familiar with platforms. We use Google, we use Facebook, we use Twitter. These are digital platforms. So when I say a platform, you automatically think, oh, that's a digital platform. This is far better than a digital platform. This is meaningful interaction as a community on a social interaction level. So it benefits everyone. This platform is for 7 billion people. It has a great opportunity to bring people together, to tackle social isolation at the same time as we grow our economies for sustainability and regenerating communities, from children in the schools with kids to our senior citizens with seniors. We all work together collectively. That's the beauty of this program and this project. It's there for everyone. We've brought it from a tweet to now on the international stage. You know, we've spoken at Davos. We're supporting the Sustainable Development Goals, their implementation in 25 cities worldwide. It'll impact over 100 million people. This is just the start. Where we see ourselves in the future is growing and evolving and supporting communities worldwide in your local community, making a difference on that circular economy model, generating income streams, but then reinvesting it back into the community. But the ownership is with the local community, so it stays local. Well, good morning, everyone. Gareth Presh, founder of the World Health Innovation Summit, and I am delighted to welcome you to WHIS Talks this morning as we talk about creative arts and the Sustainable Development Goals. This is streamed live across our Facebook and YouTube. Please do subscribe. And also, we'll have it on our podcast, which is available on Spotify and Amazon and Apple and various other channels. This morning, I'm talking to Dr. Miriam Berger and Dr. Beat Stahl from Geneva and in Switzerland. And I'm going to just let them both do a short introduction. And we're going to talk about how the arts and creative arts can help and support people's health and well-being, and also public health messages, health literacy, very important during these times of COVID. Let's start with Miriam. Perhaps you could just do a very short introduction and then we'll go to Beat.
Yes, good morning. Thank you, Garrett. So my name is Miriam Berger. I'm a medical doctor and a professional musician. I have worked clinically in pain therapy, clinical psychiatry, and public health in Switzerland, and was also trained in global health delivery in Boston at Harvard University. And I do have a great passion for the gong instrument, for the therapeutic gong instrument and the violin. And I have my focus in my work at the interface between sound, music, and health. And I also work for the WHIS, and happy to be here today. Thank you.
Thanks, Miriam. And if anyone has any questions during the broadcast or afterwards, you can get in touch with us. Do pop them in the comments, and our panel here will be happy to answer them. Beat, good morning. Welcome, and delighted to welcome you to our discussion this morning. Please tell us a little bit about your work at the University of Geneva and some of the other activities that you're involved in around the creative arts.
So good morning. Thank you very much that I was invited to join this meeting. So my name is Beat Stahl. I'm a medical doctor from Switzerland, from the Basel area, and then in internal medicine. And then I had the opportunity to work in Africa, in Cameroon, for several years. And this was an important experience for a change of my career and of the vision, what should be done to improve and strengthen different health systems. So I then followed a public health master, and finally I started to work as a teacher in Master of Public Health and became the coordinator of the medical cooperation with Cameroon from University in Geneva, and worked then as well for sometimes for WHO or for WHIS Foundation for strengthening health systems. And more I saw in these different systems and challenges, I discovered the the potential of cultural activities to better sensitize communities, because I'm convinced that for health promotion and for better health performance, we need, of course, the contribution of the community and how to speak them. And medicals very often have a trend to give only threatening messages, and this is not really inviting people to seek health care. And so we started by some songs, music for health, and to invite as well people for playing WHIS, and this became then an important experience. And now we are looking how to implement it a little bit in a sustainable way, and in link to concrete programs like tuberculosis. We were only working, and now for corona crisis as well, and then eventually for sickle cell disease or for mental health, and so the spectrum becomes larger.
That's a very big spectrum, but it's it's great to actually see and hear that, you know, these initiatives are already there, and they've probably been there for many years, but probably now with COVID-19, communication, information, digital age gives us this great opportunity to kind of reach the masses. And you talk about music and its impact. Could you give us some examples, perhaps, you know, of some of the projects that you have or you've had that uses these cultural means to actually improve health and well-being? Because I think that's a lot of learning for a lot of people who'll be listening to this.
Mm-hmm. So one song, for example, we created was on that were two songs for tuberculosis. One with a group in Zimbabwe called TB or Not TB, and from the Shakespeare, TB, to be or not to be, tuberculosis, not tuberculosis, and to say it's important that when you think there could be a problem, so seek health care and follow the treatment and so on. And then we added another song on the jazz standard Fever, where we said it is important not to discriminate people who needs to follow long-term treatment, which is the case in tuberculosis. And yeah, exactly. And as well to say, don't stop the treatment when you feel better, because tuberculosis.
ETB free. A conversation to end TB. TB or not to be. That is the conversation we need to free to end TB. To spread ahead like a wave what is said. To talk TB, infectious words with friends.
Just a little bit of an insight into what you've been doing, Bert. Sorry, we just thought we'd play that.
Yeah, that was an important meeting with WHO presence in Moscow, and then had some good consequences, in order that the WHO then said, okay, I think we will now start music for World Health Assembly as well, because this gives a good ambience for the welcome, and to say that we are we give a social message. We are together. We have good ambience. Yeah,
absolutely. Miriam, the power of sorry, Pete. Sorry for interrupting. Go ahead.
No, and so we created as well a song for the malaria, because one of the big problem in malaria is that in tropical areas, people, when they have fever, they think it's malaria, and they take malaria drugs. And we know from scientific studies that only 1 or 2 of 10 fever situation is really due to malaria. So we need to have tests, and because if we use too much the drugs, we will create resistance and spend money for nothing. And so we created for the International Malaria Day a song as well for 1, 2, 3, listen to this message, and to say, go when you have fever for a test, and only when you have test then take the drugs, and take only good drugs, and not just somewhere buying and so on, where you're not sure.
Yes.
So that are a little bit the ideas from the direct messages. And other messages are to integrate people for discriminated groups, to offer them in the public, and that they can tell their stories afterwards, like so with the teenage mothers, for example, and this is then very accepted and give them the validation that they are socially active.
And powerful messaging as well. And it's also a nice way of bringing the community together, as you say, through a cultural activity, which then has wider benefits in terms of mental health and well-being, because we're social animals. So really big impact here, but something that we need to look at in more focus, probably post-COVID, because given the stress and the pressure that the current services is under, you know, with recruitment and retention of staff and the lack of medical personnel, particularly in the regions of Africa, these are areas that they can focus on in terms of preventative measures. They could actually potentially lead in this space. Miriam, your work with the gong, sound, and can you give a perspective from your side on how that can impact people's physical, emotional, spiritual well-being, please? If that would be great to get an insight from your perspective.
Yes, of course. Can you hear me?
Yeah, go ahead.
You can hear me. Okay. So I'm just gonna pick up the last words of Beat. Also, I find it fascinating how music and sound and the tool of songs, creating songs, is used here in this context, because what you do is you take a message that is not very well received if you just use it in spoken words and in a medical terminology, and you transfer it into an ethnoculturally embedded context where you can connect with the feelings and the organically grown understanding of each of the person within that culture, and they can pick up the message so much easier and actually implement it in their understanding, because we as you said, we're talking to communities in countries that are not necessarily very highly educated, or didn't have the advantage or the benefit of higher education, or they're working in a completely different field or different context than doctors or healthcare workers. So you're bridging here in a very elegant way health literacy to all kinds of, all parts of society. And that's very important work, which is a bit underrepresented, I think. So I'll go to the gong work now. I worked in psychiatry for a couple of years, and with a psychotherapeutic approach and all kinds of psychiatric illnesses. And one of the major challenges that we have nowadays is the whole circle of diseases, or the whole field of depression and stress-related disorders, and it's gonna be it's not gonna vanish soon, I think. We have to come up with new ideas to get a hold of this, and also before the illness gets fully onset already. So there's the preventative approach, there's the health promotion approach, there's health management and therapy. And where I come in with the gong is on different levels. I love to do it in the preventative on the preventative level as a rebalancing of everyday stresses that you experience, and that you want to that kind of sits in your unconscious, and that you try or tend to ignore while you're working and you're in full flow throughout the day. But stresses like deep beliefs about how you should be, how life should work, how you see yourself, or what's the definition of success. And we live in a society where success is very strongly linked to high performance and being always on the run and being always, representative for something. And I mean, we're humans. We cannot be all the time on high performance, and we learn that balance is something that we need to we need to train balance. And the gong and sound therapy, or sound work, is a tool to give you that space where you can relax and where you can go into the into the yin phase of, if you want to say yin and yang. Yang is the high performance, and the yin is the relaxation and the recreation, where you fill up your batteries, you recharge your batteries. And it is also a very gentle way to bring you from a working mind state into a deep restoring state. When we work and when we are on our high performance mode, we are in a completely different brainwave state than we are when we get into deep relaxation. And meditation, like probably now everyone knows, meditation is a very good path into, from coming from this one state into the other state. And what I found and what I learned throughout the last years is that sound can be the elevator. When meditation without sound is the stairs, sound meditation is the elevator to this restorative state. And there are not, interestingly, I haven't found any big, any studies or any scientific evidence on gong work so far, but there's a lot of anecdotal evidence and empirical evidence from talking to clients, patients, to people that use gong and sound healing in their lifestyle setting, and it's quite stunning. I personally did one session. I remember last year I did one session. A friend who came with a problem of polyarthritic pain, and we did a 1 hour session, and she had the typical pain pattern in her hands and fingers and feet, and difficulties to take the stairs. And after 1 hour of the gong session, she stood up and said, "There's nothing. Like my hands are totally, pain free." And she went up walking, and she had no pain in her feet. And then texted me later the day, "You know what? I've been running up the stairs without a single problem." And I think, this is one example of what sound can do. And there's also, of course, other modalities in the gong. There's sound bowls, there's crystal bowls, there's the so-called theta healing, there's music, there's the experience of music. We know that classical music, for example, has a huge impact on us. And yeah, so this is a little excursus from and a little example from what I've been dealing with. And
perfect examples, Miriam. Great insight. Also, I wanted to just talk to Beat as well now, just about, because that's all value creation. Because, for example, that individual, that patient, she's then able to potentially go back to work. Beat your cultural experiences as well in Africa, for example. Can you give us some examples? We spoke briefly offline about some of the work you've been done with in terms of maternity and mental health and well-being. Can we put that into context? Because I think what I'm trying to look at here is the future of healthcare, because at the moment the whole system is based around cost. Okay, so everything has a cost. But what it doesn't look at is value creation, okay, which is probably the most important thing that we miss. In the cycle of healthcare, it's all about, well, how do we create the value? And what I mean by that is, if I'm sick and unwell, I can't go to work, I can't do anything, I have to go to hospital, which is a cost. Whereas if we do actually look at the preventative side of medicine and healthcare, which is health, good health and well-being, keeping people fit and well and healthy, if we invest in that, that creates more value for our communities, for our societies, but also gives us an opportunity to invest in creative arts and these programs that you talk about. So I'd love to get your insight on that.
Can I, is for Miriam, or can I give just a brief comment?
Please do, please.
Because
yes.
She just mentioned about scientific studies, and a colleague from our Institute of Global Health at the University of Geneva, they are an institute for neuroscientific research about music and brain capacities, and they tested now from young children, 7 to 12 years, when they are playing music or music in an orchestra, they will strengthen their capacity for memory 5 times, and they will have other capacities for sharing emotional challenges and the capacity to adapt to different situations in life, which is important. And the city of Paris then created now already 40 orchestras in vulnerable neighborhoods of Paris to give social support. As you mentioned, Gareth, it is important to validate prevention and good health. And I think
Fantastic.
This is an important point. And even for big institutions like WHO, we were once invited by the general director to play music and to create integration with the community, that they sing and they dance when they had a meeting of all services about infectious diseases. He did that when he started, and he said, because they are used now to work a little bit separated, there are diarrhea, schistosomiasis, malaria, and so, but he said for the prevention and good care of this disease, there are many common points. If, for example, you say you need better sanitation, this is for many diseases, but if each group works on better sanitation, this doesn't make sense. They should integrate. And so we had then an evening with music, and we invited them to sing and to dance. And afterwards, people, they were very happy, and they said, oh, that's great. I now met colleagues from other services. I think it's nice to meet with them, nice to discuss with them. I think I will start to work with them as well. And so we said, okay, that is a good way to bring people together in a non-challenging way, and that then they use later on this good experience, because it's not a technical challenge, and it has to do, as you said before, with well-being. And we can promote well-being with music.
I completely agree. It also suits very well the biopsychosocial model of health. When health is not only biological, it is psychological and social, and we're whole beings, and we need to tackle this holistic approach as you do with the music and embedding into these social structures, and it helps community building. I completely agree. I also want to pick up your note on the studies on the brain. We know also that musicians and in general people that do arts, but particularly musicians, have a very strongly developed corpus callosum, which is the connecting part between both brain parts, and it helps to work very cross-sectorally throughout the whole brain. So this is an interesting fact about the brain. And there's also ideas about how meditation can help recalibrate and organize and overall connect the brain like that. So sound meditation and music interaction, it all comes. They're all very interesting on this level.
Absolutely. And if you look at the medical model that we have at present, for example, and it's not even rocket science. So if you're sick and you're unwell and you go to your GP, you get 10 minutes. Okay.
Yeah.
Out of 24 hours a day. I mean, the rest is all social. You know, that's the impact of your health and well-being. That's where the real value is what's happening outside the consultant's room. It's what
you have
you do.
To go outside.
You know,
yeah.
So that's really the message of opportunity. But a couple of things, we had a couple of questions as well, like, you know, great talk about sound therapy. How are you bringing this remotely in COVID times? And is there any creative art projects for teens? So firstly, I'll just want to pick up on this and we can go around the house because I'm sure Beat, you have lots of projects and Miriam has as well. But just to say, yes, on the 20th of October, we'll be in the UN Palais launching our Arts for SDGs. We'll be meeting with the UN Director General. We'll also be talking to the the WHO DG. That's one of the projects. B, I hope you can join us. I'll send you an invitation. And the other thing is we're doing some really big work with the Vatican at the moment. We will be launching concerts around the world in our cities. We'll also have a silent night concert on the 24th and 25th. We'll be covering the likes of Nagasaki. So there is a lot of movement going on in this space. We have our SDG orchestra, and I think this will be so valuable in terms of over the next few years as we implement the SDGs to link our orchestras with the likes of Paris, because that your initiative that you mentioned there, Beat, with 40 orchestras, because one of the mandate that we have, WHIS has with the Vatican, with the concerts for the poor with Pope Francis, is to measure the outcomes of people in poverty. So, and that's around the social determinants of health. And what I mean by that is what we're tasked to do, and Miriam's part of the team with myself, we wrote the brief, it's gone, it's been approved, is that we will be tasked to find out when we meet with people who come to our meal and listen to the music this year, next year, what is the outcome for their health and well-being? We've got to measure that, and we have to make sure that their mental health has improved, their physical well-being has improved, so that we actually show some tangible outcomes. And hopefully by that stage, it shows that they have employment and that the wider impact on their life is shall we say, flourishes. So, Beat, do you have some projects that you could tell us about in this context? Because Jill has asked that question. And also, is there any projects for teens?
Yes, we have several things ongoing. So as I said, for the mental health, the project for the teenage mothers, which is important. And now, for example, for a better empowerment for people living in the Corona crisis. There is from Switzerland, from Swiss Tropical Institute, a new application for contact tracing, but which is an app empowering people. They have to activate it by moment. It's not automatic because they say it's important that people can decide themselves whenever use. But then we said, okay, but how to promote the use of that? How to communicate in a large way and in a sympathetic and acceptable way. This will be important, that there will be local music productions. So for Cameroon music, for Mali music, for Zimbabwe music, and so on, that have a song and that tell, or in a brief theater or with a song demonstrate what it is good for, how it works, and then to see how we can disseminate this kind of contact tracing app. And there was another project in Cameroon together with Islamic Bank of Development for promoting blood donation, because they are now in several big hospitals, centers. They are developing high technical laboratories for blood transfusion. But when you don't have people that bring the blood, it doesn't. Yes. And people, they are not so happy to say about these heavy diseases, surgery, and so they. So that would be a use as well, and say, but if you give blood, so it will it will save lives. And we wanted to create as well songs for that with the big band. Myself.
Absolutely. Yeah. I
And so
posted
there
all
are
those.
many opportunities, and in South America about the Chagas disease, which is as well a problem to give access to them and to tell with music, not discriminate, but be active and make art. You can be part of a patient association, but stimulated by music.
Absolutely.
I have to mention that I thinking about the example with the COVID-19 the tracing app that you mentioned about the African countries. I see a huge potential also in reaching youth, because young people want to interact in their life in a fun way. They want to, they listen to what is fun and enjoyable. And if you pack messages into embed them into music and in something that talks to them, you can engage them in a much more efficient way than just sending a sentence or doing an advertising or something like this. So there's this connection to the youth, and the youth is the future. You all know that.
Yes. Yeah, no, it just brings great opportunities, Miriam, in terms of engagement and cultural engagement. I've also, just to let people know, I've posted all the links. They're all in the chat bar there, so people can look at the videos that Beat's spoken about, Miriam's spoken about. I just want to I just want to look at the future, and we'll finish on this note, actually. Look at the next 12 months, 24 months, and look at the opportunities that the creative arts space brings. I know we've had some comments around photography, music, painting. There's various different ways of being creative. Miriam, I'll ask you first, where do you see the opportunities in terms of mass engagement coming out of COVID, from living with COVID, because we're going to have to live with COVID? How do we potentially turn this situation, which is a worry for people, into an actual opportunity where people can begin to flourish? I don't think we should go back to normality, which is what we continuously see and is promoted across the airways, because we also have environmental challenges. And yesterday, just for an example, I live in the countryside. I went for a walk, and I'm walking along the road, and on the side of the road I pick up a plastic mask, that's discarded out the window. And I kept thinking to myself, we really are not learning here, in terms of what are we doing with our response, even to COVID, from the point of view, well, we know microplastics are in our ocean. They then ultimately lead into our food chain, which ultimately then causes cancers and all sorts of different problems for us. So where do you think the music and the arts and cultural and in the next 12 months, is there an opportunity there? Miriam?
So Garrett, I definitely I see opportunity there. I mean, we can use music and the arts in a row of SDG related contexts, and what you're talking about is taking care of our environment, growing conscious about our planet and how we treat each other in society and our planet. It's about growing conscious and growing, into responsibility for this. And the arts are a way to not only to communicate it to communities and to to catalyze interaction and catalyze messages throughout the community, but also the arts are a way to look inside, to get a path and an access to your inside. And we as humanity, we have to work. I mean, we need to work on our inner life, on our understanding of who we are and what really makes us happy, and what is also relevant and necessary for us to flourish in the future. And that is, of course, community. It is engagement with each other. It is sharing knowledge. It is building, supporting each other, and building a future together that is not only built on profit, but also on restructuring our economies into a circular model where we don't just throw away stuff, we buy and throw away stuff. We recycle, we use our knowledge to create something new out of nothing or out of something that is already existent. And I believe there's a big change happening at the moment during this Corona crisis already, because we are forced to take a break, and we are forced to face our own fears. We are forced to sit here and think about what's really important for us. So music, of course, is a great tool for that, and also to express it. And arts are a way to express what's going on inside you, and also to connect with other people and create community. I mean, meditation, for example, is so impactful and powerful in this sense, because meditation, for example, does, and I love how it's spreading throughout the globe, this habit of meditating, and this idea of focusing on your inside to go outside again. Meditating helps to recalibrate your thought structures, and helps to get into metacognition, where we are conscious about our unconscious, and we get familiar with ourselves, and we can train to get mindful with ourselves, and not identify with emotions, or with, in this case, with fear and anxiety, which will push us into the wrong direction. So, so coming back also to mental health is massively about stress reduction and creating the space where you're fearless, where you're ready to go into the unknown. And meditation is about training, like any other habit as well. So my advice to, I guess my first advice to everyone is start meditating, train it, do it every day. It's going to be hard in the beginning, or not that easy, but once you get into it, like into any habit, it will just flow, and it will increase your life quality in such a great way, and increase your inner and mental stability. And, I love waking up in the morning and thinking of, hey, I'm going to meditate for an hour. It's going to give me so much joy and so much energy. I'm just going to, flow through the day and do my thing.
And when I may add a point to that, what was completely unexpected, but which is a proof of the effect what the music, through the music, how a community takes part and appropriate the message. Because for this Corona crisis, when I sent the melody from the Geneva professor for It's in Your Hands to the Cameroonian colleagues, and I said, you say here is a song for hand washing, and could you play that and use that as well, and we can translate it in French. And then we translated in French, and then 2 points were, I couldn't even expect that is spontaneously, but it shows how important it is through the music. But I say, but we compose another melody because we want to speak to our community, and themselves we want appropriate the sense of, and so by music we express emotions. So it has to be consistent with the message. So we have our own melody. Okay, that was great. And then they say, and French is the official language in Cameroon, but we all have local languages. So we translated it to the 3 most used local languages used in Yaoundé. Oh, great. So this shows how you may transfer a message which the community appropriate, and of course this makes another sense. And then I sent the Cameroon variation to Mali, and original as well. And so I saw there is already a Cameroonian version. And the guys from Mali said, no, that's tropical Africa. We are in the Sahel. I created a Sahel music. And the same, so this shows it's not only a specific point of a person doing that. It is something which seems have its value, and which is something integrated. And so if we multiply that in other countries, I think it will still change again. So this shows a strength of that approach.
And I also
True empowerment.
Yes.
Mm-hmm.
I also think it gives a great example, Beat, of the future of healthcare, because in the past we've had a very top-down structure where we tell you what to do and how it's evolved. But I think what you've just shown is how messages can be adopted to local situations. And what I mean is just in terms of the cultural side of how we disseminate information around the world, around diseases, shall it be, or future practices. We have to have the buy-in locally. We have to build the trust. You have to co-design, co-create, and very much listen to the needs of the local communities, because each community is different. Each needs are different. And so one size does not fit all. And that's where the likes of WHO, WHIS, and other institutions around the world, they need to understand that it's got to be localized, but it's got to be done in a co-design. You've got to listen. You've got to understand. You've got to accept as well that this is the way it's done here. And then this process takes time to evolve. Listen, I'm just going to say thank you very much for joining this morning, Bea and Miriam. It's been a pleasure to have this discussion with you. I'm looking forward to further engagement and how we evolve and deliver the SDGs over the 2030 agenda. For everyone listening who's, maybe on a record or on a podcast, thank you very much for taking the time. And if you need any further information, you can check us out on whis.uk, and we'll be in touch. Our next episode next weekend is around health literacy. Dr. Manuela Boyle will be here, and she'll be discussing health literacy from a global context, and she's got some fantastic guests from around the world joining us. So from myself, Bea, and Miriam, we'll say goodbye, and thank you very much for joining us this morning. Thank you. Bye-bye, everyone.
Do you have a project to join Geneva in the next